Welcome to week 11 of Intro to Holistic Medicine. I am your professor, Dr. Erica Steele. I'm a board certified naturopathic doctor with so many degrees in my field, 7 to be exact. And I went to school really to teach the world holistic medicine and all the different distinctions. This week, we get into patient education. So it's important to be properly educated, number one, understand your scope of practice, understand what your limitations are based off of your training, but furthermore, learn how to educate, motivate, inspire, and empower your patients by using patient education and also knowing where to find reputable information, because right now we are in an information overload, and unfortunately, everybody thinks they are an expert in holistic medicine. Everybody thinks they are an expert of natural medicine. Even if they were eating McDonald's literally 6 months ago, now all of a sudden they are a holistic health guru. So if you see my sarcasm, it is because it's very frustrating as a senior citizen in holistic medicine. I know I look 12, but I've been in this field for a long time, 20 plus years. I've seen people come and go. I've seen health influencers come and go. I've seen medical doctors come and go. And really, we want to be able to educate the general public on the proper ways. So if we part of the reasons why I do these courses and part of the reasons why I wanted to get into education is to create a standardization and a structure, because there's so many things that are just being thrown out there because there's a lack of structure. For instance, people are calling alternative medicine holistic medicine, right? Alternative and holistic are not the same. Alternative medicine is literally lacks complete science. All alternative medicine is it's looking up whatever diagnosis or whatever conventional treatment that's being recommended, and you find whatever alternative is there. There's no scientific backing for it. You're pretty much just throwing paint up against a wall to see what sticks. And so that's one of the distinctions we want to have, is being able to identify that not only for yourself, but being able to educate your patients on the distinctions. Just like with functional medicine, there's a lot of providers in the medical community, in fact, who are calling themselves functional medicine providers simply because they know that, there's a financial gain to it, but they have no training, or the training they have is so minimal. You cannot be skilled in functional medicine with a weekend workshop. And unfortunately, when I'm in a lot of these, professional groups, I'm seeing that when practitioners throw out, oh, what do I do for this diagnosis? We don't diagnose in functional medicine. And so maybe in allopathic medicine, that's actually in allopathic medicine, they do diagnose, but not in functional medicine. We are looking at the function of the body. We are trying to make the body work well and the body to heal, which is pretty much, functional medicine is pretty much a more modernized naturopathy, to be honest with you. And so they've pretty much taken all the things, and then we bring it even back to holistic medicine. All of it really comes back originally to holistic medicine and our Afro-Indigenous roots, where we were, eating healthy, working with the plants, working with the land, working with our communities, working with our spirituality. Now they've kind of co-opted it into, again, naturopathy, and then eventually into functional medicine. And so we want to make these distinctions this week, and we want to understand the difference between alternative medicine, integrative medicine, functional medicine, holistic medicine, naturopathy, and understand the difference, because otherwise we're just throwing stuff out there. And I see so many people throwing words out there that they may or may not understand. In most cases, they don't understand. And so it's very much an uphill battle. If we are all educating our patients, we want to be able to educate them on a standard, right? Because if there is no standard, if this person is doing this or that person is doing that, then it gets extremely confusing. So we want to make sure that we understand what it is we're trying to teach our patients, and we work in collaboration with our patients. We're not the authority. We're not there to tell them to do everything. We're there to really work with them, motivate, encourage, and inspire them. So all this week, we're going to be working with patient education, looking at language, and looking how we can, again, make sure that patients are getting the information that they need so that they can be an active participant in their health. So we're really excited for week 11 of Intro to Holistic Medicine. We are almost done with this course. I cannot even believe it. Next week, we'll be into week 12, which will be our last week. And so last week I was traveling, it was a little crazy. And so I have recorded all of the videos, the 2 videos that we have. They're all in the course shell. And then I'll be sending them out. Finally, we got our approval to text you guys. So anybody that's in the course will receive a text message today letting you guys know where to find the videos for last week so you guys can catch up. I tried to make them short videos so they weren't super, super long, but this week I'll be back on live and we'll be going over all of the information together. So if you have any questions, feel free to reach out. Of course, after our 12-week is over, we will take 3 weeks off so everybody can kind of rest, take a break, but most importantly, catch up. I'll be going through all of the modules and just making sure that it's clear and really finalizing our Intro to Holistic Medicine 1. So Intro to Holistic Medicine 1 is a course all about to introduce you to holistic medicine, the complexity of it, but 1 is all about the nutrient deficiencies. We look at your subjective and objective data so that you can determine where you may be depleted and what organ systems may be affected based off of those nutrient depletions. After our break, we'll move into Intro to Holistic Medicine 2. And so that is all about detoxification, as well as we'll have our 4-week collectives, which I went over as well in our Saturday, would have been our Saturday course that's already recorded. So super exciting week of patient education, making sure that you understand what our standards are in our field, making sure that you're operating again within your scope of practice and you know what we're doing so that you don't sound ignorant out there. So awesome. Like, share, subscribe, comment for more. And I'm super excited to move on and get this get her done. So awesome.